Hello, hello. My name is Krista Harris.
Hi.
I have the pleasure of sitting with Nasa McCall. Did I say it right?
Mako, yes, close enough.
No, I don't like messing up people's names. So Nasa Mackall, who is a family nurse practitioner. We are going to be getting into talking about how to find a nurse practitioner and what to look for. So before jumping in, I'm going to introduce myself. I'm Krista Harris. I am the founder and the creator of the Black Brown Delaware Therapist Directory, which is a directory that was created and launched in November, and it is for individuals in the state of Delaware to find a Black or Brown mental health provider, nurse practitioner, or psychiatrist. I am also a mental health therapist that's licensed in the state of Delaware. So, being as though May is Mental Health Awareness Month, I created also a platform called What's the 411 on Black Mental Health. So, every week in the month of May, I highlight a new topic. This week, we are highlighting how to find the providers that are a good fit for you and what to look for. Even if that provider doesn't look like you, that's also okay. So that's why we also want to highlight things that are important to look for to make sure that you are a good fit. So that's why I'm so grateful and honored to be meeting with you. So Nasa, can you do a little intro of yourself?
Okay, yeah. So I am a family nurse practitioner. I work here in Wilmington, Delaware, at a practice called Trinity Medical Associates. We have Wilmington offices as well as Middletown and Newark. And I basically, as a primary care provider, we're the ones that you come to your regular doctor's office to see, like your main doctor. So I treat adults. That includes both physical and a little bit of mental health. I see women for well woman exams and pap smears. I don't see any kids at all. We don't see kids at our office, but just the kind of, we try to integrate, care, physical, mental, and women's health all together.
I love
Mhm.
that. I love what you said about integrating the physical health with the mental health because some people see those as two separate entities.
Mhm. No, they definitely coincide. Your physical symptoms can present, as mental illnesses and vice versa. Your mental illnesses can present with physical symptoms, and, mind, body, and soul all work together. So, we have to consider all parts.
Absolutely. So, Nasa, we're going to
Mhm.
jump right in there. And you kind of explained a little bit in your intro. What exactly
Mhm.
is a nurse practitioner, and what is the role? Why would somebody come and see a nurse practitioner?
Okay. So, a nurse practitioner is a registered nurse who has a master's degree that allows them to see patients similar to how you would see your doctors in your regular doctor's office. I can treat you, I can diagnose you, I can refer you, I can prescribe medicine, everything pretty much that your primary care physician can do. I just come from a registered nurse background. And what was the second question? I'm sorry.
Why would because I'm all about promoting mental health and physical health. Like I said, they definitely
Mhm.
go hand in hand, right? What are some
Mhm.
times and I'm all about preaching being proactive versus being reactive. What are some
Mhm.
things that a person would go to the doctor for or go, come see a nurse practitioner? What would be some of those reasons?
Okay. So, I mean, physically, of course, anything, pain, high blood pressure, diabetes, any of those chronic conditions that, you might have any bodily function that's going on. Mental health wise, we do see patients with mental health issues, anxiety, depression, bipolar, anything, any personality, disorder, anything. In mental health, I'm not, a psychiatric nurse practitioner, but I do have some training in mental health. So I do, I treat mental health issues. If there's something that I cannot treat or I need help with, I can always refer out to a psychiatrist, to a therapist. We do have one psychiatric nurse practitioner at my office that I can refer to as well. But, I'm pretty confident in treating, a lot of conditions. So I do that in the office, just as I do physical health. But if I do need help or if I feel like I need to refer, then I have that option as
Awesome. Are there any main what is it? Main annual
I
or
think we
yearly?
froze here. Wait a minute.
Oh, can you hear me okay?
Um,
Can you hear me okay?
yeah, sorry, I don't know what happened.
Now, what are some again, I want people to know when they should be going to the doctor or seeing their nurse
Froze on
practitioner.
me.
Uh-oh. That's the thing what happens with the technology. Can you hear me okay?
Sorry, you froze a little bit. I heard you say
I
that
said
question
no,
one more time. I think I'm good
no,
now.
like I said, I want people to
Yeah, I hear you
know
now.
when should they actually see their nurse practitioner besides like them having pain. When are some times that they should go to be proactive? What are some of those appointments that they should be
Mhm.
scheduling?
Okay, definitely. So everybody should have an annual exam once a year. That's much a head to toe assessment, vital signs, making sure your blood pressure and everything is good. We also usually do like annual lab work, check cholesterol, blood sugar, all that kind of stuff. So that's annually. Also, women should be having women's health exams. Pap smears are usually only every 3 to 5 years, depending on your age. But you should still be having annual, just kind of women's health checkups, breast exams, things like that, that we can do. Usually for people who are a little older, maybe 65 and up, we like to see them at least a year. Minimum once a year with your primary care for your annual. If you have conditions like high blood pressure, diabetes, asthma, cholesterol, all those kind of things, we do like to see them a little. Just it's kind of on a case to case basis, but for me, at least every 4 months, I would like to see my patients with those kind of chronic conditions.
Okay, okay. And I did not know that about people that may have like the high cholesterol or what have you going at maybe about every 4 months. I didn't know that. As far as women, because I know you said sometimes you give pap smears, how often should women be getting pap smears? Can you hear me?
It's kind of coming in and out.
Yeah, I was saying
What's going
I know you
on here?
mentioned something about you doing pap smears. So how often should women be getting pap smears?
So I believe the recommendation for 21 to 30 is every 5 years if you're getting HPV tested, or 3 years if not. So I think on the safe side, everybody's every 3 years.
Hmm.
You should have a pap smear, which a smear is the test where we actually collect of the cervix to look for signs of any cervical abnormal cells.
Hmm.
That's different from just a regular kind of exam where we're just kind of looking and doing a breast exam and things. So you have to make sure that you're up to date with both of those breast exams and a pap smear.
How often should women be getting their regular? Because I know you said they're different. So how often should they be getting their annual women's appointments? Or
You kind of broke up. You said how often for the breast exams?
yes, how often should that be?
Okay. So breast exams, we do them alongside with the women's health exams. So if you're coming in for an annual exam, we do that annually, especially for over 40. We like to do an
Mhm.
exam. So we do that, and then I would refer you out for a mammogram.
Okay. Okay. Gotcha.
Yeah, so annual exams are.
Our connection, I'm not sure what is going on. So it looks like we lost her. So I am hoping that we can continue with this. Give me 1 second. I think she's here. Hello.
Sorry, I'm not sure what's going on with the Wi-Fi. It's on. It's connected.
Yes, it's that's just the devil. That's what I always say when we're
Yes.
trying to give out the info. So
Yes.
I did hear you say that getting your pap smears, we're going to I think every 2 to 3 years if there's not any issues. As far as mammograms, you were saying how often should you get those?
Mammogram should be annually if you're 40 years or older, or if you're high risk based on family history or your own personal history.
Perfect. Okay. So
Mhm.
Now, I'm not necessarily saying you have to find a doctor or a nurse practitioner that looks like you. If
Mhm.
so, not if depending on what that's your preference, what you choose. But what I do want to always preach as far as like finding your provider is that they are a good fit. So,
Mhm.
Nate, what are some things that people looking for a doctor, looking for a nurse practitioner, what should they look for when making sure this is going to be a good fit for them?
Okay. So you definitely want to find somebody who listens to you and believes your symptoms. You know your body better than anybody else, and nobody can tell you, what you're experiencing, what you're feeling. So someone who believes you and listens to you, somebody who advocates for you and reaches for other resources if they don't have them there for you. Somebody who will refer you to the proper resources. If you think that you need therapy, then you should be referred to therapy. Or if you think you need to see some type of specialist, then they should help you to facilitate that.
Hmm.
You also want somebody who doesn't force their own beliefs on you. Somebody who listens to what you believe in and doesn't force medication, right away as the first line choice, unless, that's what you want. And someone who's just non-judgmental, somebody who's up to date with current events, because those things affect, both our mental and physical health. And somebody who's up to date with their own medical research, and their own education, and someone who answers your questions honestly. Yeah, I think those are the most important things. Someone who listens and advocates for you.
I love that. Now, this is kind of like a side. This is kind of really a question for me too. Now, I know sometimes, well, I just found a new nurse practitioner and I love her. Um,
Mhm.
now, and she took her time. She didn't rush. What are maybe some things? I know I hear people saying too that like when they go see their doctor, their nurse practitioner, it's like maybe 15 minutes and then that's it. They're done.
Yeah.
You say about that time frame, because I know you guys have to keep a strict schedule and things like that. So what can maybe a patient do to make sure that everything they need is taken care of within the
Mhm.
time that they're allotted?
Yeah, so that's true. Especially for physicians, sometimes they are scheduled every 15 minutes. So it's hard. Usually nurse practitioners were scheduled every 30 minutes in most practices. So we usually have a little bit more time. But I think to prepare for your visit, first of all, you want to come on time, come early for your appointment so that you can be checked in. They can get your vital signs, everything before, so that you have more time in the room with the actual provider. Also kind of being prepared, knowing what you want to discuss. Also knowing that we can't discuss everything in one visit. We can, if you're coming in for a problem visit, we can discuss, maybe one or two things, but you can't come in with a list of 10 things and think that we're going to address all of them. So more realistically, come with your biggest concerns, and then we can follow up in next week and talk about some more things. So it's just more about prioritizing and knowing what you're there for, coming on time and just being ready. And, the provider should respect your time just as much as you respect theirs.
I like that. I like that. Um,
Mhm.
so, Nate, another question that I have for you that is important. Where do, well, let me before this question. What is maybe
Mhm.
one myth that you hear, or a common concern that you see amongst clients, whether black, white, yellow, green? But what is maybe something that's common or
Mhm.
that you hear or see?
I think a lot of people feel misheard or rushed sometimes, for the same reason that you said. Sometimes they only have 15-minute visits and they're not getting their concerns heard, or they're not feeling heard. So I think that's something that I experience a lot. A lot of people also feeling judged, or actually they're being afraid to talk to their primary care. I saw a post on Instagram yesterday that was like, don't be afraid to tell your doctor that you smoke and you have sex, because those are real life things. So,
Right, right.
come to me and be honest and tell me, what's going on, so that I can help you get to the bottom of whatever the problem is.
Absolutely. And let me
Mhm.
ask you this before we kind of wrap up. I'm all about advocating for yourself too, right? And like you said, one of
Mhm.
the characteristics to look for in a doctor, nurse practitioner, what have you, is that they advocate for you as well, right?
Right.
If you're not being heard, it is okay to say, you know what, let them know that you feel not feeling heard, maybe feeling judged. And if nothing
Mhm.
changes, then finding a new provider.
Yeah, definitely. I mean, you should, if you like the person that you're with, you definitely want to speak up and tell them that you don't feel heard and you have these issues that you want to, to hone in on. So that's important. And if they're not addressing your needs, or if you're feeling like they're not a good fit, they're not a good judgment, you're not stuck to them. You can request to see somebody else within their practice, or you can completely, leave the practice. But you also want to, before you see a provider, to do your own research, get referrals, read reviews online. There's websites, plenty of websites now that review doctors and nurse practitioners. So you can get a pretty good idea of what you're walking into before you go.
Absolutely. So
Mhm.
before we wrap up, Nasa, last year you created a bomb list of providers. Some people do not know where to look for a doctor or
Mhm.
nurse practitioner. So how can people find that list? What can they do to find a provider?
Okay, so I created a list last year because I did see that there was a need of, Black and Brown individuals who were not being seen by Black and Brown providers. So that list is on my Instagram page. My Instagram is Neysa, which is Neysa underscore 391. I'll also share that with Krista so she can pass it along. I'm going to update it as well. And then also you can look on websites like ZocDoc or Health Grades, where you can search for a doctor in your area. You can read their reviews, see their, how many stars they have and things like that. So I think those three are, good resources to find a primary care.
Awesome. So,
Mhm.
Lisa, I want to say thank you so much. I know I
Mhm.
definitely learned a couple of things that I will be promoting and passing on, such as when to make your annual appointments, when to make your mammogram appointments, how
Mhm.
often you should be getting checked when you have things such as like diabetes and high cholesterol. Um,
Right.
also, and I will also tell everybody how to find your information. We'll put that in the comments, in addition
Mhm.
to so they can find that list for them. So
Yeah, good.
thank
Mhm.
you so much for joining me. We had a couple little bit of tech issues, but we
Yeah.
got the information out there.
Yeah.
Okay.
Thank
Uh,
you for having me. I appreciate everything. I'm glad to share.
yes. So,
Mhm.
guys, I'm going to have more this week as I'm going to be talking to Shonda Reynolds, Dr. Shonda Reynolds, later this week. And we're going to be talking about what to look for in a mental health therapist, in addition to what is cultural competence and what does that mean in regards to finding a provider. Again, this month is Mental Health Awareness Month. So every week I'm going to be coming to you with the 411 on Black mental health. Have a great night, and I'll see you later this week.
Thank you.